New at 10 for one Nebraska man, a bill in the legislature is personal. The bill would provide clean needles to drug users, but Governor-Pillen vetoed it. Channel 8's Mackenzie Johnson tells us what's next in this story. Mackenzie?
Senator Megan-Hunt's bill passed with support from both sides of the aisle, but Governor Pillen says he vetoed it as soon as it hit his desk. Now, one man is sharing his perspective as lawmakers try to override the veto.
People that are addicted to heroin and other drugs are going to use drugs whether they have clean needles or dirty needles.
Mark Welsch heard about LB 307 just a couple of weeks ago, but once he did some research, he was in full support. Introduced by Senator Megan-Hunt, the bill would allow pharmacies and local public health programs to create syringe service programs. They would offer safe disposal of used needles and syringes and hand out new, clean ones. The goal is to stop the spread of diseases like HIV.
My family member that is a heroin addict had told me, a couple years ago that these kinds of needle exchanges were saving people's lives in other states.
The pharmacy or health program will also hand out educational materials and give referrals to mental health and substance abuse treatment. That's what will make the biggest difference, Welch says.
It will save lives by putting these drug addicts in touch with health professionals as they get their clean needles. That will give them a chance to be talked with about how they can get off that addiction.
The bill passed in the legislature, but Governor Pillen vetoed it. In a column on Tuesday, he says in part, quote, Legislative Bill 307 would authorize the state-sanctioned distribution of syringes to drug users. In other words, the bill would enable drug use by equipping addicts with free needles. If that sounds crazy to you, let me assure you that you're not alone. I vetoed LB 307 as soon as it reached my desk. The bill has no age minimum for who can receive needles, which Pillen says encourages minors to abuse dangerous drugs. But Senator Megan-Hunt says that Pillen is fear-mongering and that no medical professional will hand out syringes to young children. After Pillen's veto, she released a statement saying in part, quote, Governor Pillen seems to have a fundamental misunderstanding of the function of SSPs, which serve as a doorway for accessing treatment. The relationships, resources, and referrals people obtain from an SSP are often the first opportunity for treatment they receive. Senator Hunt will need 30 votes to override the veto, and that's exactly how many she got on the final reading of the bill, though a dozen senators did not vote. Of course, we'll be keeping you updated with any new developments.
All right, thank you, Mackenzie.